COVID-19 has created significant mental health challenges for all demographics. Isolation, anxiety, financial hardship, fear for the well-being of friends, family, and loved ones. It is befitting today, on World Patient Safety Day, when we recognize that health worker safety is a priority for patient safety. That we reaffirm, while we have asked so much of our health workers, and unfortunately more and more of our loved ones have had to be patients during this health crisis. The truth that mental health and wellness challenges are more easily surmounted if openly discussed with a trusted family member, friend, or mental health professional. According to the CDC, 40% of U.S. adults have reported struggling with mental health or substance abuse during late June as the COVID-19 pandemic continued to impact our country in so many ways. To those in our community who feel like you're alone or isolated or are suffering in silence, please know that we see you. We also want to ensure that you are heard. We're facing a multitude of crises at the current moment, and the effects have compounded our mental health. To address these rising concerns, the Howard County Health Department has introduced a new campaign, Let's Talk About Mental Health, to promote mental and behavioral health resources and referral services available in our county. If you, a family member, a friend, are having a hard time coping during COVID-19 or due to any hardship, the Howard County Health Department is here to help guide you through the process of locating help. We can talk about mental health without the stigma. It's okay to ask someone if they're okay. We know that talking about it can save lives. There are many useful mental health resources and services available in our county, and through this health department campaign, we hope to educate and empower all of you to have an open conversation about mental health and feel comfortable calling and asking for help and finding the best services suited for you or your loved ones. Young people especially have felt the impacts of COVID-19. It has not only disrupted their education, but it's derailed so many firsts in their lives. And those life milestones like graduation, starting college in a dorm room, and made it difficult to see friends who often act as a safety net. Last year, we launched the It's Okay to Ask campaign to encourage both young people and adults to talk openly about suicide and suicide prevention. We recognize and realize how difficult this year has been, and we want all of you to know that it's okay to be upset. It's okay to be sad. It's okay to grieve the things that we've lost. And most importantly, it's okay to ask for help. In the face of the grief and pain of this year, it may be tempting to turn away or retreat into silence or solitude. But stigma and silence only contribute to the problem. And even though we must physically distant, we needn't be socially distant. Please continue to check in on one another. It's our collective responsibility to protect the health and safety of our young people and the mental health of our neighbors of all ages. Our actions at the individual level and governmental level can make a difference and can save lives.
Through stakeholder surveys, the health department learned that there was a lack of knowledge about how to access mental health services in the county. We want the health department's Bureau of Behavioral Health to be considered the key source in helping address the mental health needs of our community, whether that be defining exactly what the term mental health means, or helping connect an individual with a more serious concern to a provider. These mental health problems aren't always easy to define or clearly identify. Sometimes it's just a feeling. But we want to help if it just doesn't feel right, or if a family member or friend is acting differently and we don't know what to do, or if we don't feel comfortable in our own skin. We want you to call us. You don't need to have all the answers right away, and our behavioral health staff are here to walk you and talk you through the process. Talking about mental health with friends, families, and coworkers can be difficult. We know there are some families, some cultures, some religions that where talking about mental health is stigmatizing and demoralizing. But again, we want you to just ask and reach out. And we want to encourage everyone struggling to seek resources and services rather than struggling on your own. Stigma is often identified as a barrier to seeking mental health treatment. We want to normalize these conversations so our friends and family members don't have to suffer in silence. As the county executive mentioned, we know that COVID-19 has caused additional strain and anxiety on the mental health of many, if not all, of our families in Howard County. We want you to know that we hear you, we see you, and that we are here to help. Please call 410-313-6202 to help find the information that you need. If you or a family member are experiencing a mental health crisis, the Grassroots Crisis Hotline is available 24/7, and you can dial that by just pressing 211, press 1.
People often express confusion around what behavioral health means. Mental health and substance use disorders fall under this umbrella. The Howard County Health Department's behavioral health staff work with all populations in the county to help link those in need to treatment and other resources to address these concerns. The new campaign being launched today, Let's Talk About Mental Health, is intended to promote mental health resources available in Howard County. Through this campaign, we hope to empower you to have an open conversation about mental health and feel comfortable seeking services. We offer an array of mental health services at the Howard County Health Department, including behavioral health navigation services, which consist of behavioral health screening, referrals, and follow-up services. We also offer coordination of mental health services for youth, adults, older adults, immigrants, and other vulnerable populations. We hope that this campaign and reduce stigma about mental health will encourage more people to call and take advantage of our services. We update resource directories listing available behavioral health services in Howard County. These directories are accessible on our website and the Howard County Network of Care website for anyone seeking services. In addition to these mental health awareness campaigns, we also have other campaigns and programs that I'd like to mention. We have the Youth Suicide Prevention Program, which includes It's Okay to Ask campaign. Sources of Strength is also an evidence-based youth suicide prevention program that incorporates leadership skills development to promote help-seeking behaviors, and community connectedness. We also have a fentanyl awareness campaign to educate the dangers of fentanyl, which is often added to other substances. We also have a peer support awareness campaign to promote our peer support program, which consists of access to talk to a peer support staff who are in recovery and available for assistance to seek treatment or additional resources. We also have online opioid overdose response trainings. If you or a family member are having a hard time coping during COVID-19 or are struggling with a mental health issue, the Howard County Health Department is here to help link you to available resources. Call 410-313-6202 or seek information on our website, howardcountymd.gov/gethelp. If you or a family member are experiencing a mental health crisis, the Grassroots Intervention Center hotline is available 24/7 by dialing 211, press 1.
I live with PTSD, depression, and anxiety. Early into this pandemic, I was fine. But as time went on, it started to get a little scary for me. I thought this was just a little adventure, that this was going to pass. But as the seriousness of COVID-19 was becoming a real issue for me, the anxiety started to set in. Everything around me started to change. There were new kinds of noises, sometimes lack of noises, new sounds. 4th of July, I knew to expect fireworks, but there were none. But there were other sounds going around during that whole week. That was frightening to me. Wearing masks, people became unfamiliar to me, unknown. So now isolation is increasing, not because of the encouragement to isolate, especially because of my age, but now I'm isolating for very unhealthy reasons. At the same time, I had obligations to maintain, mostly with my involvement with NAMI, National Alliance on Mental Illness, and through my church. Though I was not originally into all this Zooming stuff, I certainly had to learn this was a new way of staying involved and still having a reason to get up every morning. I had to learn all about it, and it wasn't easy. Then it was redoing programs from in-person to virtual, learning how to do that. But then through Zooming, it became a benefit because maybe I can't see people in person, but I can now see their faces and we can see smiles. And that felt good. We started joking about how we went from, well, we have to wear a mask, to having a wardrobe of masks to match what we wear. We ask each other, are you half dressed while you do your meetings? I know I've been guilty of that. That's been very, very helpful. But I lost that passion for a while. I lost that reason to get up in the morning because this whole thing was just very anxiety, stressful for me. However, starting to talk about it, being able to talk about my fears, I missed the world as it was before the pandemic. I don't like it, but being able to talk freely with other people has been a big help. I'm not the only one. This didn't focus just on me, this pandemic. It's affected everyone. So it started making me feel this new normal. I'm not the only one feeling a little frightened by all this and struggling to adjust to all this. I'll be okay. You know, I've got my family, I've got my friends, I've got my church, I've got my colleagues. That's who's here, these programs. So all I can say to conclude this is, let's talk about mental health. We're not alone. Thank you very much.
Thank you, Debbie, for your inspiring and insightful words and underscoring why we're here today is to truly talk about mental health. And so right now we're going to open it up to questions from the press if there are any. And I'd invite Dr. Rossman and Dr. Bonaccorsy if there are any questions. And Dr. Ball? Okay.
From Channel 2, for something we're working on, if someone can address specifically students and what they're going through without seeing friends at school, without sports, without plays, without all that, and of the isolation and the dangers in that isolation for some of the students at home.
I'll take that first. Yes, we know that there are mental health, or pre-COVID, we knew and were concerned about our mental health issues of our young people. During COVID, just like Debbie explained, there's lots of young people also experiencing that social isolation, that anxiety, that uncertainty, and that loss of normal life that Dr. Ball talked about. The proms, the graduations, the friends, the hanging out. That's hard. And that's why it's really important that we have we're communicating with our young people that we need to be able to talk about these feelings that they're experiencing and know where to reach for help when the help is needed. One of the programs that Dr. Bonaccorsy mentioned is Sources of Strength. This is an evidence-based program that we began last year with our high school students. It was in person. This year, obviously, we're doing it virtual, but with the need to switch to a virtual mode comes a positive that we can now engage more of our young people in this evidence-based program. It's resiliency building. It's helping them cope. It's giving them the tools that they need to help themselves through these difficult times, and honestly, difficult times that are going to happen in the rest of their lives. And also how to recognize when help may be needed by a friend and who that trusted adult is, or that trusted phone number for them to call to get help. I don't know, Ro, if you wanted to say a few more words.
The only thing I would add to that is the mention of It's Okay to Ask campaign, the youth suicide prevention programming that we have at the health department. Dr. Ball mentioned that earlier as well, which is a part of the Sources of Strength evidence-based program that Dr. Rossman just mentioned.
So as a father of kids in our public schools, I have a freshman and a senior. This is a critical year for both of them. And it has been challenging for them and their other peers. And it's okay to balance wanting to keep people safe, not wanting to get the disease or bring it home to their families, and being sad about the things that we're giving up, that we're losing, and we're sacrificing for the greater good. Thank you. Any other questions?
Thank you, Dr. Ball, for those final words and for hosting today's press conference, and to all our speakers. And this concludes today's press conference on mental health, and we want to thank those of you who are at home joining us.